This month on Health Digest, we have been focusing on mental health, the perceptions that we have around mental health and treatment and management of mental health in children. On this episode, we talk to the healthcare providers, especially nurses managing mental health in children and how they manage this, putting their parents at the forefront of managing psychiatric illness in children. Second, we focus on depression, how to identify and manage depression, and most importantly, how to identify and prevent catastrophic events of depression, such as suicide. Agnes Mudhoga, a psychiatric nurse, has seen many different forms of mental illnesses affecting children during her course of work at Mathare.
We have autism, which sometimes you can see the child has both autism and ADHD combined. We have cerebral palsy, we have intellectual disability. Also, our age gap is 0 to 16. So you can also have a drug-induced psychosis because at 13, 14, they can abuse drugs. And also there's a condition like schizophrenia, which they come at early stage.
Caroline Otieno is a psychiatric nurse at Mathare Hospital at the Child Psychiatric Clinic.
In child psychiatry, it's a bit different from adult psychiatry, in that in child psychiatry, it's their parents or the guardians who bring them. And it's the child, it's the parent or the guardian who perceives the abnormal behavior of the child and is able to see that my child is not growing in the right way, is able to bring the child to the hospital. And also, when a child is growing up, that is milestone, we're able to detect that my child has a problem. E.g., a child at 3 years, it's normal if she or he bedwets, but it's abnormal for a child who is 11 years. So the parent is able to see that this child is not growing in the normal way, and then is able to bring the child to the hospital. And it's the parent who perceives the abnormal behavior of the child.
Jane Washeke was at Mathare National Teaching and Referral Hospital, bringing in a girl with autism for follow-up at the Child Psychiatric Clinic, held every Wednesday at the facility. She and other well-wishers came together to assist the girl, not only medically, but even as far as taking her to school.
Okay, she's the firstborn, and mama yake ni ule hajiwezi, you see. So tukaonelea juu at home alikuwa na tumiwa vibaya, unaona anaachwa. You see, she's just alone and she has a condition of which lazima uangalie ndio at least umsaidie. So we came together and tukasema we have to help the kid, you see. And that's where we came. Tukampeleka shule. The first school hawakuwa wanamsaidia. So the second school tukaenda for the admission and stuff, and then they wakaturefer huku because of, let's say, lazima fanyiwa assessment. Then we came to realize that akona condition ya autism.
At first, at the beginning, when I started attending those patients, I was so moved because of the condition they could come with. I was so moved, sometimes I felt even I didn't want to work. But of late, I'm used because they need assistance, and I have to gain courage so that I can assist them. Sometimes you can see a patient for the first time, you feel so bad, and then after 3-4 months, you see the patient coming back. You feel like hugging that patient because the patient have really improved.
Ruth Mwaura is a psychologist who has seen patients with mental illness get better with time with the right treatment.
From those ones that I've seen, there's a lot of positivity, especially when they understand it, because most of the people, they do not understand. So when they come to you and they understand this is depression, this is bipolar, this is schizophrenia, this is a mental illness, they're able to, there's positivity along the way. But there are those ones who maybe when they feel they're okay, they no longer come to the clinic, but again they like fall off. But those ones that really appreciate, especially when somebody has been with this illness for a long time and they now understand what it is, there's a lot of positivity.
Back at home or when she was growing up with the parents, how did the mother and those around her realize that this particular child probably has a problem?
walikuwa wanamwona nyumbani most of the time, akienda shule anarudishwa. So, and then she used to smile a lot. But then walikuwa dile wanataka kumsaidia, but wanashindwa tampeleka wapi. They didn't know the condition. So anaona vile ana smile, but later walimu wakakuja wakasema mtoto ako na shida. So the parents kuja kumwachisha shule.
And from your own experience, you deal with girls with various challenges. How or what do you think are the main challenges that children with mental disability or mental challenges go through on a day-to-day, both at home and in school? What are these challenges or unique challenges that they face?
Most of them they're neglected. Unapata kwa nyumba, waniko kwa nyumba peke yake. They don't take it to school, of which si vizuri. This kid ni mtoto ana grow. It's only that bado hajajijua vizuri. The parents should be there kuwa guide, kuonyesha upendo. And ukionyesha mtoto upendo, there's nothing she can't do. Like atakuwa najua hata nikienda shule niko na mama mahali ama niko na baba mahali. So most of our parents hawafanyi hivyo. They just leave them, wanawacha kwa nyumba. Most of them napata wanachapwa, na kitu wanachapiwa si ati ni kitu wangeweza kuavoid, as in hawakuwa wanajua.
You could see a mother coming with a child. This child cannot talk, cannot walk, cannot even if she's feeding, because sometimes they feed when we are together. This child doesn't know how to swallow, doesn't know even how to chew. So the mother struggles so much to feed the child. So that's what made me to be moved. And maybe the child is 15 years, and the mother is carrying the baby the child on her back. And you could see that mother's mother is so stressed and so worked up. And then I also felt very bad, because I could see most of the patients who always come to us, they're always with the mothers. So I was wondering, where are the father? And when you take history, they will tell you, the very moment the mother realized that the baby have abnormal behavior or is growing abnormally, is growing with abnormality, he took off. So most of our patients, they are having single parents, and the single parents are the mothers. You rarely get both parents coming together. With our African culture, anything bad always belongs to the mother. Even in the school, when the child performs badly, the mother says, you took after your mother. So whatever came out of that child, the father decides, maybe that's what I always think. They think that this took after your family. Our family doesn't have watoto wa vilema, vitu like those. So they just leave, and maybe the men take off to go and look for other women. Maybe they'll give them better children. And then being a parent as a woman, you cannot leave your child. So that's why you see the mother keep on going with the child.
It takes the parents a long time to accept that this child of mine is sick, to seek medical attention. Secondly is denial. In most cases, the parents do deny that this child of mine is abnormal, has some abnormal behaviors. So it takes them time to seek for medical attention. For the families we have handled, child psychiatry, it brings dysfunctional families and even separation for the parents. Most of the husbands tend to move out of the family when they come to realize the child has some psychiatric problems.
From my perspective, I think there's a lot of stigma when it comes to mental health. People in the society view mental health in terms of madness. First, they don't understand it is an illness. So basically, they don't understand what mental health is. And most of the people that have issues with their mental health do not get the help that they need because of the stigma and the perception that the society has about mental health.
Some things, I have just had them thinking that maybe amerogwa, comes from this family. It's not for our family, of which we try to make them believe it's not that, because most of them comes maybe from the time of pregnancy, during labor, and maybe a fall.
The girl's mother, seeing the improvement her daughter is making, has had to learn how to deal with her daughter's autism.
Amefundishwa kidogo kudeal na yeye, cause at the same time tuna bado haski. Okay, at some point anasikiza but inakuja inazima. So mama yake amekuwa akimsaidia like sign languages, all that. Yeah.
Na mama
Ana try kumcontrol kuacha kusmile. Like she'll tell her, don't smile, tukiwa hapa don't smile, and she listens.
And we realize that most parents bring their children and it's a little bit late. They don't pick out these issues early. What are some of the reasons from the parents why they didn't come early enough or in time for their children to be attended to?
Apart from a condition like intellectual disability, a condition we used to call earlier mental retardation, you might not realize early enough. Because the children with the intellectual disability, there is a probability of knowing it early. Because already there is growth retardation, there is mental retardation. You might realize early, because a baby of 6 months might be looking at a baby of 2 months, so you might realize it earlier. But something to do with the ADHD, with the autism, unless the baby start becoming active. And maybe you expect this baby to be walking or to be talking, and then that time the baby is not walking or talking. That's the time you realize the baby have a problem. So already it takes time.
Most people think it is witchcraft, and they do not see it as a medical condition. So before they even come to hospital for medical attention, first they have taken these people to traditional healers, somewhere, a place where they need to be prayed for. So what the society thinks about mental health is it is something that comes out of witchcraft and not medical.
Autism starts at the age of 3, but you get a parent coming at the age of 6, 8, they don't accept that disability. So they come in very late.
There is what we call normal growth of the baby, where we monitor when the baby starts smiling, at what time, at what month, because there is exactly at which month the baby is supposed to smile, at which month the baby is supposed to concentrate and look at you, at which month the baby is supposed to be teething, at which month the baby is supposed to be sitting down, walking, crawling. So if you miss those things, they are not going according to the age the baby is supposed to go, you can detect there is a problem early. And you can go and look for advice or intervention early. By the time they come to us, they have already gone round. They have gone to, maybe some to traditional healers, some have gone for prayers. Okay, they might come to us and they won't tell us they have gone to traditional healers, but they'll come to us and tell us that they have been gone for prayers. But at long last, they have seen there is no changes. That's why they have come to us. And they come to us when it's too late. Maybe there was a condition which could have been reversible, but it have already advanced.
At first, when we get them, there's a lot of denial first because of the stigma. They kind of understand mental health just a little bit, but because of the stigma, they don't accept, especially when you see somebody and you tell them this is a mental health, this is a mental illness, there's stigma, so they don't first accept it. But over time, as you talk to them, as you explain to them what this is all about, they get to understand, and some even appreciate, because some of them maybe they come to you but they have been suffering for a lot of years. So by the time they come to you and you explain to them what has been happening, they now understand, oh, now this is why this has been happening, this is why this person has been behaving the way they behave. So at first, there's a lot of resistance, especially when you give somebody a diagnosis of mental illness. But over time, slowly they come to appreciate and now accept that this is mental illness. I think first is for them to understand what this is, because of the different diagnoses that are there when it comes to mental health, mental illnesses. For example, if a person comes with depression, first you have to explain to them what depression is. What are the symptoms of depression? What are some of the causes of depression? For them first to understand about depression. So once they understand that this is depression, these are the symptoms, they have occurred during this period of time, then from there they're able now to know, first understand the diagnosis, then slowly by slowly help them cope, help them be able to deal with this patient with their illness and not out of the fact that could be something else and not the illness.
Do you think as a country we have the capacity to deal with mental illness affecting children?
Yeah, we have. We have in a way that is the government should try to create awareness to the community all around so that people should know how to realize the problem early for early intervention.
I do think that sometimes, especially the primary health care, at the clinics, at the dispensaries, I think they also need to be equipped or maybe get education when it comes to mental health, because basically that is where people go. Before they even come to Mathare or any other psychiatric hospital, they first go to the clinic, they first go to the dispensary. So I think also there will be need for them to also capacity build when it comes to issues of mental health, so that they can understand that when this person comes to you, after you've assessed for all other illnesses, are you assessing for mental health? You know, because they start with you, it takes time before the person maybe even comes to a psychiatric hospital. So if something was done maybe earlier on, when they came first to the dispensaries with the clinic, they were able to identify the symptoms and even refer this person to the right place, I think it goes a long way.
The place we have here in Mathare Referral Hospital, it's a unit by itself. And sometimes it gives us a hard time because we have patients from all over Kenya coming to be seen here. And I know almost in every referral hospital there's a psychiatric doctor who could see these patients. So I would like if they could set a child psychiatry clinic at every referral hospital, because it could be easier for them to attend them.
I think as a country we are still far. We've made the strides when it comes to mental health, yes, but when you see the institutions that handle mental illnesses are few. Take, for example, Mathare. It's the only government-owned psychiatric hospital, yeah? And mental illness cuts across the country. You can't say it's just in Nairobi where patients are coming for mental health, but it cuts across the country. A lot of people out there are those ones who don't even understand what mental health is. Yeah? So as a country, we feel we've not reached there. Institutions for psychiatric illnesses are still very few. When it comes to human resource, the psychologists, the psychiatrists, they are still few. Because when you see as a country, basically most of the psychologists and the psychiatrists are in Nairobi, the urban areas. What about deep down in the remote areas? Very few or none at all. Then when it comes maybe to medication, we are doing something as a country, but I think still there's a long way we need to go.
If they can get a way to create awareness to the people outside, because people have failed to understand mental illness is a disease like any other. If everybody should understand a mental illness is a disease like any other, we could be able to control. Because mental illness, you can control it as the way you always control diabetes, hypertension. You just take drugs and you go with the normal work. But due to stigma, people don't accept mental illness. So what I think should be done is awareness.
Mental health in Kenya, there's still a lot of stigma. We are making the strides, but I think the government needs to push the agenda when it comes to mental health so that people can understand. Because a lot of people, when you see all these cases of a person murdered somebody, the wife, the husband, suicide, all these things point out to mental health. But I think still people, because of the stigma, a lot is not being done. So I think the government maybe needs to do more when it comes to mental health so that the society can understand mental health. Then they get to understand it and also refer the people to the right places where they can be helped early enough.
Health Digest takes a short break.
This is KTN News.